Hello, my name is Rachel Myers. Welcome to my research presentation on the effects of magnesium supplementation on blood glucose in gestational diabetes. Magnesium is an essential mineral needed as a cofactor for over 300 enzyme reactions in our bodies. It is known for its function in blood sugar control. Unfortunately, many individuals do not meet the recommendations for dietary magnesium. In the United States, the National Health and Nutrition Examination Survey data has consistently shown magnesium intake lower than the recommended amounts. This could lead to negative health consequences in those with increased insulin resistance. Research has shown that magnesium is needed by insulin receptors to correctly function and respond to insulin. Of note, there is potential for increased urinary excretion of magnesium in those with insulin resistance conditions, such as type 2 and gestational diabetes. Gestational diabetes is a condition which can occur in late pregnancy. The rate of diagnosis of gestational diabetes is increasing in the United States, now affecting at least 10% of pregnancies. In gestational diabetes, the mother's hormones cortisol, estrogen, and human placental lactogen can block insulin, which in turn increase insulin resistance. This can cause negative health consequences for the mother and the unborn child. The upper limit is 350 milligrams per day for the pregnant population for magnesium supplements. The research question is, in adults with gestational diabetes, will 300 milligrams supplemental magnesium glycinate provide the best improvements of blood glucose levels over placebo or standard therapy? In a research review of the literature, 3 studies were found which discussed the effects of magnesium supplementation on blood glucose in gestational diabetes. All 3 reviewed subjects with gestational diabetes for 6 weeks, providing supplements of 250 milligrams per day magnesium oxide. The goal of each study was to find out the effect of magnesium on fasting plasma glucose. It was determined in all studies that those receiving the magnesium supplement did have a significantly lower fasting plasma glucose. So what questions have arisen from the literature? Further research is warranted on this topic. Magnesium oxide is the poorest absorbed form of magnesium in the human body. The literature could be further improved with research on a form of magnesium that is better absorbed, such as magnesium glycinate. Also, the current research has only studied the supplement magnesium up to 250 milligrams per day. For the study design, the method of choice will be a controlled trial using the safeguards of double-blind control with placebo and randomization. This experiment will also feature a washout period and alternate intervention, allowing each study participant to be tested against themselves with both the placebo and the treatment. The goal of this study is to determine if there is a cause and effect relationship to supplemental magnesium glycinate and improvements in plasma blood glucose. To determine the sample size, a t-test correlation point biserial model a priori power analysis will be used. Given the shown parameters, a total sample size of 88 participants is recommended for this study. Inclusion in the study will be based upon biological female status, at least 18 years of age with diagnosed gestational diabetes, based on the use of a 100-gram oral glucose tolerance test. 2 or more of the values from the test must meet or exceed the limits for gestational diagnosis. They must have at least 12 weeks remaining in their pregnancy and be within 25 miles of the study facility with adequate transportation to return to facility 4 times per the study duration. They would be excluded if they were enrolled in any other clinical trials for gestational diabetes and/or magnesium supplementation or had a history of sensitivity to magnesium. All participants will sign an informed consent agreeing to participate in the trial. They will be informed that this is strictly voluntary and may discontinue the trial at any time. As this population consists of pregnant females, the study itself will have to be reviewed through an institutional review board prior to initiation of the study to ensure that all safety parameters are followed. Pregnant women are a vulnerable population. In order to diminish ethical concerns, this study will not test magnesium supplements at or over the tolerated upper level limits of 350 milligrams a day for supplemental magnesium. The intervention type will be randomized, double-blind, placebo-controlled clinical trial. Blinding of the treatment is required in order to protect against bias. The duration period will be 4-week treatment periods divided by a 2-week washout period. The total length of time will be 10 weeks. The treatment arm will receive 300 milligrams of magnesium glycinate in a gel capsule, and the placebo will have a similar size and shape of gel capsule made from inactive ingredients. The sampling procedure will have study participants being selected from all local provider and OB/GYN offices in the surrounding 25-mile area. The research setting will be a centrally located hospital outpatient office in downtown Boise. The fasting plasma glucose will be tested with a single vial blood draw. These tests will take place early in the morning prior to food intake and will occur on week 1, 4, 6, and 10. This correlates to the initiation of study, end of first leg of study, beginning of the second study arm, and the end of the second study arm. For the data analysis, a KS test will examine if variables were normally distributed. This study will also determine a p-value. The two-sided ANOVA will be used to determine the effects of magnesium supplementation on plasma glucose. Currently, women are not receiving magnesium as a standard therapy for gestational diabetes. With the additional literature support for magnesium glycinate supplementation, it could be reasoned that this intervention could become standard therapy for gestational diabetes. The epigenome is much more susceptible to environmental cues during early development. By improving blood sugars in this population, it may benefit those with increased risk for diabetes. This Gantt chart is included to show a timeline for the study. Thank you for your consideration and focus to this research proposal presentation.